Hello beautiful people and welcome back to another video. My name is Sakshi and I'm 5th year PharmD student. So on my latest vlog on hospital activities, I got a comment saying what is patient counseling, and that was a bit shocking for me because being a PharmD student, that is one of the most crucial thing that you have to learn apart from finding adverse drug reactions, drug-drug interactions, etc. And I'm really sorry for the noise. It is coming from the below, and below is our hostel mess. So yeah, I'm really sorry for that. Without any further ado, let's start on to what is patient counseling. So patient counseling is basically where you provide the patient with information regarding either his health condition, his medication, what happens if he does not take a medication on time, benefits of medication adherence, that is what to do upon missed dose, what are the complications that would occur along with the disease if he doesn't follow the lifestyle modifications or the medications that have been provided to him. If it is a psychiatric patient, then patient counseling can include what all are the things that his family members or his caretaker have to keep in mind so that the patient is better managed. So yeah, now there are different steps of patient counseling. First comes preparation. So in preparation, I would like to highlight how would you choose a patient for patient counseling. For example, right now I am posted in ortho ward. Now there are 3 ortho wards and there are minimum 10 patients per ward. So you cannot counsel 30 patients altogether, right? So what you should be doing is that you should choose a patient either who is very young, by very young I mean less than 20 years of age, or patients who are very old, or patients who are presenting with multiple comorbidities. Alright, so you should be choosing your patients that way. For example, if I have to do patient counseling, then first of all I'll see which patients are due to discharge tomorrow or in near future, and I'll choose those patients because they are discharging. So ideally patient counseling is done before the patient gets discharged. Okay, then I'll identify who are the youngest patients, who are the oldest patients, and who all are the patients with multiple prescriptions or polypharmacy, or who all are the patients who have maybe faced an adverse drug reaction or side effect of any medication, or have allergy due to any medications, patients who have multiple comorbidities such as they have diabetes mellitus, hypertension, etc. So that all happens. And also in preparation, what you have to do is that go through the patient counseling, go through the patient cases extremely thoroughly. Okay, identify what are the medications that he is taking, what were the presenting complaints, what were the complaints that the patient presented with, etc. Find out if there are any drug-drug interactions or adverse reactions which are seen in the patient through his vitals. Check his daily vitals since the day he came till today. Check all the vitals, check especially blood pressure, check ECG if it is given, and all of that. Very soon my ECG notes would also be provided, so stay tuned. I think in a month's time, in month's time I'll be providing you guys with my ECG notes also, and honestly they are so good. I don't only cover ECG interpretation in that, I also cover what are the medications, when they should be given, why they are given in those cardiac conditions only, and different types of cardiac diseases are also covered. So stay tuned for that. And already my PharmD first, second, third, fourth year notes are already scanned and they have been uploaded. So if you want any of those notes, then feel free to mail me at patelsakshi164@gmail.com. So that is it with the preparation part. You just have to prepare what all the counseling points you will provide to the patient based on his disease conditions or the medications he is taking. Next comes introduction. So now you go to the patient, you give him your intro. For example, if it is me, then here the vernacular language is Gujarati, so I'll be talking in Gujarati. કેમ છો કાકા, આજે કેવું છે? મારું નામ સાક્ષી છે અને હું તમને અમુક સલાહ આપવા આવી છું. But if you are encountering an old person, then he might not like when you tell him कि आप उनको एडवाइस देने जा रहे हो. So you should just tell him that તમારી દવાઓ આપણે ડિસ્કસ કરી લઈએ, something like that you can tell to the patient. All right. Okay, so for introduction, that part is there. Also tell them that you are a PharmD student, and it is in your duties that you tell the patient about any drug interactions that are there, to discuss about how he should be taking his medications. And also while you are giving your introduction, you should assess if the patient knows enough about his disease condition, the level of education that the patient has. You should judge that during the introduction part. Alright, if the patient is someone who is not able to understand, then start from very basic questions such as do you know what has happened to you? Do you know why are you taking this particular medications, or why you have been admitted? Because trust me, there are so many patients who don't know exactly what is happening to them or exactly why they have been admitted. Alright, so that comes in the introduction part. Next is actual counseling. So here you make some counseling points. Whatever counseling points you have made in the preparation part, you cover them up in actual counseling part. Now this portion will vary according to the patient that you are counseling, according to the ward that you are posted in right now. For example, if it is a pediatric ward, then you cannot say that bahar ka khana mat khana, don't eat outside food and stuff like that. Okay, in pediatric you have to counsel the mother that these are the points that should be taken in care. You have to give him boiled food only, or you have to take care of him in certain way according to whatever disease the pediatric patient has presented with. Okay, now some of the points that I have written are: first is medication administration. This mainly happens in medications such as eye drops. If the patient is given eye drops, inhalers, suppositories, then you have to counsel patient upon how to take the medication. Alright, for example, if it is eye drop, then tell the patient that whenever you open the bottle, quickly in I guess 2 to 3 weeks, use that bottle completely. Don't touch the nozzle of the eye drop, don't leave it open, close the cap tightly immediately after use and keep it out of the reach of children, or they would swallow it or suck upon it, something like that. So you have to give that advice to patients who have been prescribed eye drops. Next comes inhalers. So inhalers also, a lot of the patient don't know how to use it. Tell them, advise them properly how to use it, show them pictorials or show them a video about how they should use it properly. Like you have to pump it and then you have to close your mouth and stuff like that. So advise them very carefully. And for inhalers, you can obviously also show videos. I think that would be better if you show the patient a video, a good enough video, that this is how you should be taking the inhaler. And not only the patient, also counsel the patient caregiver. Okay, next is suppository. There are so many cases where multiple rural women, they take suppositories orally, because the doctor thinks most of the time that the patient knows how to take suppositories, but it is not so. Many times they take it for example, if a patient has presented with vaginal infection, if they are given not suppositories but I think pastry, I forgot what it was called, so whatever that is given, so most of the time they take it by mouth, which is not at all the way it should be taken. The patient would still be suffering and complications can happen very rapidly, because vaginal infection can travel very rapidly to her uterus, to her kidneys and stuff like that. So counsel them very nicely, very thoroughly about how to use their medications. Next, for medications comes dosage, missed dose and late dose. Okay, for example, for dosage, tell them that how many tablets you have to take, when you have to take, how you have to take. Whether if it is an antibiotic such as tetracycline or stuff like that, then tell them that don't take it with chai, or don't take it with coffee, don't take it with milk, or don't take it with banana. Banana is still fine, but advise them accordingly whatever medications they have been given. Tell them not to take it with orange juice also, because sometimes ascorbic acid reacts or vitamin C reacts with it. Next comes missed dose. So what should the patient do when they have missed a dose? This is extremely common question. So according to the half-life of the dose, you have to tell them. For example, if it is a case of vancomycin, this just occurred very recently. So the patient had question about what if they forget about giving their son vancomycin injection on time, and if they forget, then till how many hours they can still administer the dose. Okay, so vancomycin, it has half life of I think 8 hours. So if the patient forgets vancomycin, then no problem, but within 2 hours of the missed dose, for example, I'm so sorry, I am extremely sorry for the noise disturbance. Alright, so for, where did it go? Did I just delete it? No. Oh, I archived the note. Alright. So for missed dose and for late dose, for example, if yeah, I was discussing vancomycin, right? So if the patient has missed the vancomycin dose, so if the scheduled dose was at 6 p.m. for example, yeah, for example, if it was at 6 p.m., then they can still take it till 8 p.m. but after 8 p.m. they can't take it. So advise the patient accordingly. If so, then tell them that wait for 2 to 3 minutes, I'll search and I'll tell you. Okay, but don't at all give them wrong information. Okay, it is completely alright. They also know that you are a student and they will appreciate you taking your time and doing adequate research and then answering them, rather than just blindly answering them anything. And for medication dose, always research thoroughly and then tell them. Okay, missed dose, late dose, whatever, so advise them accordingly according to the T half of the drug. And also, if so, then you can ask the intern that is this information correct, or maybe the main doctor that is this information correct, something like that. Those are actually motion sensitive lights, so it stopped. शुरू हो गया. Alright, benefits of adherence and compliance. For example, if it is a tuberculosis patient, or if it is a diabetes mellitus patient, HTN patient, then tell them the benefits of completing. Also typhoid patients, bacterial infection patients, then educate them about the benefits of medication adherence, medication compliance, or completion of the medication dose on time. Alright, so because tell them that what all complications can occur if they don't take their medications, what are the complications of diabetes, what are the complications of hypertension. You should tell them very thoroughly, not in the way that patient gets scared or thinks that you are hypothetically talking, but with actual facts. Okay. Alright, next comes potential side effects. For example, if the patient is given rifampicin, then you should advise the patient that maybe your urine color may change, or your lacrimation or teardrops may change in color. They might turn more yellow, orange, something that color. Alright, so advise the patient accordingly. Next comes storage of medication. This is very important. Tell the patient when you have to put them in cool temperature, that is when you have to refrigerate them, when you have to keep them away from the sunlight or in dark cupboard, or just at room temperature normally. Okay, for example, insulin, most of the patients, they store their insulin open vial in the fridge, which is incorrect. Before the vial is open, you have to keep it in fridge. Once the vial is open, you have to keep it outside. So advise the patients accordingly, advise them, tell them that this is how you should be storing. And always if the patient has a small child at home, even if they don't have a small child at home, always tell them to keep it on the highest shelf possible, so that no child takes the medication. Alright, okay. So apart from these points, these were all pharmacology related points, right? Now comes non-pharmacological points or lifestyle modifications. If it is diabetes mellitus patients, if it is hypertension patient, then advise them what are the lifestyle modifications they have to do, light exercise or meditation, diet. Especially in diabetes mellitus, most of the patients, they don't have their diet in control. So tell them to have the diet in control. And also one thing with diabetes is that the patient get hungry also very soon, very quickly they get hungry, and they get hungry a lot. So tell them that whenever you sit for meal, you can have a roti, one roti or one chapati at a time, and then again when you get hungry, in for example for 1 hour, then again have maybe half chapati or some fruit or some kind of salad. Okay, so tell them that you can eat throughout the day, but don't eat a lot in one sitting. Okay, and this is also true for pregnant ladies. Tell them to not eat a lot of food at night, not eat a lot of fatty food or fried food at night, others they might have vomiting, or they might not be able to sleep nicely due to burping and problems like that. Okay, and for example for GERD patients or patients who are suffering from PUD, then you can advise them to sleep on their left side. Next comes SRD diet, BRAD diet, etc. Now SRD diet is just salt restrictive diet, so that is mainly implied in patients with hypertension. Also patients with CKD or AKD, tell them to be on fluid control, restrictive fluid control. For example, they can only have 2 liters water per day or 1 liter water per day, stuff like that. Okay. So yeah, salt restrictive diet for hypertension patients, fluid restrictive diet for CKD and AKD patients depending upon their kidney functions or their GFR. Next comes BRAT diet. Now BRAT diet, it is essentially advised for patients who have been diagnosed with typhoid or with any kind of intestinal problem or stomach problem. For them BRAT diet is very essential. So BRAT diet, it is essentially the patient should have mainly banana, rice, BRA, so apple and toast, banana, rice, apple, toast, that is BRAT. So advise the patient that way to have BRAT diet. If you give such mnemonics, then the patient will understand very nicely and they would be able to show compliance towards your advice. Okay, next comes physiotherapy or exercises. And one more thing about giving mnemonics is that, for example, if the patient has to skip medications for 2 days, then instead of telling that don't take the medication today, you can tell them, for example, that don't take your medications on weekend. Saturday, Sunday, don't take medications, it's your holiday, or keep it as an off day. Then that way the patient will be able to understand better. The patient will have better compliance because it is easier to understand. Now, okay, now today is Saturday, tomorrow is Sunday, so I don't have to take medications on Saturday, Sunday. That is much easier to remember than remembering, oh, I last took it on Monday, so it is okay if I don't take it now on Wednesday. The patient might forget because most of the patients are geriatric and stuff like that. So that is it. And if you want me to do ward wise patient counseling, then also let me know in the comment section below. If you liked it, then let me know, and what are the points that I should add in my next video, or what are the other points you would want me to cover in relation to our course. So that is it, guys. I really hope that you gained a lot of information, that you will imply all of this information for your beautiful patients. And that is it. Goodbye and have a beautiful, beautiful day. And keep watching my videos. You guys, can you hear any noise in my background? It is at least comparatively less to when I was recording. Now when I have stopped recording, the noises have also stopped. And when I was recording, since the past half an hour, there were noises from the lift, from the outside people who have their homes outside our hostel, and from the basement also, where the mess is. This is very irritating, very humbling, and I cannot record this video again. Trust me, it was a very long video and I cannot do it again, so it is what it is.